Welcome back to the chat. A female track and field star is making headlines this week over a controversial policy. Under the hyperandrogenism policy of the International Association of Athletics Federations, female athletes with high levels of naturally producing testosterone are not allowed to compete on the ground that they have an unfair advantage over their peers. Duty Chand was banned by the Athletics Federation of India in 2014 under this policy. She challenged it, resulting in a suspension of the ban for 2 years. Now that suspension time is up, so she's preparing to battle all over again. Joining us now, we welcome our medical contributor, Dr. Ali Kasraeian. All right, so we have this condition, hyperandrogenism. It's a really long word. And this is the focus of this whole case. Women who naturally have a lot of testosterone in their bodies. What is this?
So it's a really interesting, the philosophical question with this is it fair to keep women with this condition from participating similarly as keeping a tall woman from participating in other sports?
Because it's natural. It's something you're born with the high levels.
And it's a disorder. So the federations kind of looked at the idea that this condition causes an improvement again in strength, speed, and power because it increases lean body mass. So that's the idea with this. It's basically an increase in androgen. So from the name of it, hyperandrogenism, and so it increases your sex hormones, which is testosterone is one of them, and so that can increase masculinism, and so your masculine features increase. So some of the conditions that women with this disorder get, and this really kind of shows up in the late teen years. You can have more masculine features. You get more hair in the body and the face areas. Some people actually can have a baldness in the hair, in the scalp. You can have a deeper voice. Acne can be an issue. It tends to be common potentially sometimes with a disorder called polycystic ovary disease. People can have difficulty.
That's pretty common.
Yeah, so about 90% of women who have polycystic ovary disease have issues with potentially having secretion of increased androgen of these sex hormones.
Now, how many women are affected by this?
So with this, about 5 to 10 women of reproductive age can be affected by this. By this
5
disorder.
to 10 women
of reproductive age.
Okay.
Total. So of women
really
of reproductive
small.
age, 5 to 10% may be affected with this.
So it's a really small number.
What creates it? It's genetics, or is it maybe a medicine they took?
So it's interesting. We don't quite know 100%. There have been speculation. Could it be a genetic contribution? Could it be something to do with insulin sensitivities associated with a variety of different factors to stimulate the ovaries to make a little bit more testosterone? There have been factors looking at potential adrenal abnormalities. So there's a condition called congenital adrenal hyperplasia that can be affected.
Now, if you have this, is this something that you would normally treat somehow? Can you even treat it? Because if you already have high testosterone, you can't really take that away.
So you can give anti-androgen. So you can potentially give medicines that would combat the increase in the testosterone. Again, with hormones, it's very interesting. The world of hormones, just like diabetes and thyroid conditions and things of that nature, hormones work on this very elegant negative feedback mechanism. So you kind of play with the way the body works with the mechanisms of whether the hormone levels are too high or too low, and the body's constant mechanism of checking itself. And so there are hormones that you can give above and below the pathway to make sure that you can control it a little bit from that standpoint. But a lot of times the mechanism of treatment of this are based on the symptoms and the spectrum of severity of the disease. Sometimes depending on what the cause may be, you can use oral contraceptive, anti-estrogen-based anti-estrogen-based therapies as well. So it really kind of depends on the spectrum of disease for a lot of women. And
so it's classified as a disease.
Yeah,
really?
It's hyperandrogenism. It depends on, and for this again, most women who have this, it's not because they are competing in athletic endeavors and they do checking of testosterone levels, and then they go on treatment because they want to compete in world stage of the world championships and the Olympics and things of that nature. People show up with masculine appearances in their late teens. They have infertility issues. They have irregular menstrual cycles, or obesity is an issue.
It can be very embarrassing if you're a teenager and you're a girl, and then you've got all this extra facial hair or hair in your body.
Imagine the psychiatric, the psychological and social anxiety associated can be profound. The other aspect to think about it, excessive testosterone levels over the course of your life, and even the early years that is unchecked and untreated, can have profound impact on your health and your body over time. It can lead to a number of things. It can lead to obesity. It can lead to hypertension. We talked about the insulin aspect of things. That can lead to type 2 diabetes. We've talked about the impacts of diabetes for years now on this show. And then we talked about the psychological aspect, the social anxiety, and the long-term effect of that in terms of a woman, especially in those early years and the teen years, which can be hard to begin with.
All right, well, something else we want to talk to you about, the good news that has come out for older moms or those who want to be. In previous research, there's always been sort of a negative between older mothers and poor cognitive scores in the children. But in a more recent study, that association was reversed. The children born to the 35 to 39-year-olds did significantly better on the cognitive testing than the children born to the younger mothers, aged 25 to 29. So this begs the question, what's causing this change?
So, I mean, we've seen recently, a study came out this week, showed that fertility rates in general have hit an all-time low. And one of the things that they looked at is that women are beginning to delay fertility, or so delay, their fertility plans to enter the workforce, and so they're having children later, and that's translating to potentially having fewer children. And again, that's not a bad thing. And this study actually celebrated an interesting thing. So they looked at a number of studies. So this study looked at 3 studies. One was in 1958, one was in 1970, and another one was around 2000 to 2002. Looked at more than 10,000 children in each of those studies. And these were women who had children in their 20s, 25 to 29, and also women in 35 to 39 age. And they followed their children and followed them when they were 10 to 11 years of age, and looked at their cognitive abilities. So how they were doing on how smart they were, and on various different scores. And the earlier studies found that the children, to the older moms, I apologize, the comment to our audience and everyone at the table. Again,
surely not to us, because we're not old.
But I mean, you may be in the future. So with that, they did not do quite as well. In the newer study, in the 2000 to 2002 study, they actually did better, and they went back and they could really attribute this to the socioeconomic, and the circumstances surrounding the women who are older in the modern study. So the most recent study, the characteristics of the older mothers in the modern era were completely different than those of the older era.
So wait a minute, so they're tying it to the fact that older moms may be in a better financial position, maybe better educated, etc., than younger moms?
I actually made a list.
Okay, I want to hear this.
Yeah,
this is really interesting.
That's what we love about you.
So, I mean, it's interesting. In the older study, the women who were in the 35 to 39 age, one, were maybe poor. They were not as socioeconomically advantaged as the newer study. So the newer study, the women who were in the 35 to 39 age were more educated. They were more advantaged and more well-off socioeconomically. And also, 26% of them were giving birth to their first child. And the other study, 11% were giving birth to their first child. And in the older study, many of them had multiple children. So this was not their first child, and they were poor from that standpoint. In the newer study, the older moms, especially compared to the younger moms, were more likely to breastfeed. They were also less likely to smoke. That was a big deal. So imagine
these studies are so interesting. All the things that they reveal.
So the other thing that more other studies looked at, there was a study out of Denmark, and other studies actually have found this. Older moms, because of where they are in their life, are more psychologically flexible, more cognitively. So they have the thing to be able to deal with all the different complex stimuli that children, especially younger children, can throw at them and constantly throw at them at the age. And so they're essentially more prepared to deal with what children throw. So as the children grow up, they're more ready to deal with it. So the children are more able to see how to deal with life a little bit more so than maybe the younger moms are. So it's just a very interesting look at the whole pathway, which is interesting because, fertility rates and things of that nature are really a hallmark of a society's well-being, and it's a look to our future in terms of our work staff and our ability to contribute to our society and things of that nature. So the fact that our fertility rates are going down, and the fact that we look at our technological advances and things of that nature, it's really a dichotomy of what's going on in our world, and the fact that people are getting older and having few children, whether or not this is a good thing or a bad thing is a really challenge. And one thing that we have spoken about in terms of now it's becoming very much the fad of having, and more appropriate to talk about things like freezing eggs and freezing embryos and consideration of in vitro technologies and things of that nature. Maybe the discussions of family planning and those considerations are going to be had a little bit earlier when people are making decisions about what they're going to do with their careers early on, both as couples and women individually, so that we look at what we're going to do in the future, so that these aren't retroactive decisions, but more proactive decisions that people are making career choices, so that you don't have to kind of make those decisions further on, because when people approach their 40s, their fertility rates are challenged, and that's one of the things that the newer study we're talking about, that people are enjoying. You find from the study people do well, but the experts are worried that what happens when people are having more challenges in terms of when they want to have children and are not able to, and that's affecting a little bit of our fertility rates.
Right. All right. Well, thank you very much. Interesting stuff.
Very interesting
today.
stuff.
All right. Thank you very much, Dr. Kasraeian. This medical contribution furnished by Kasraeian Urology. You can hear more from Dr. Kasraeian on his weekend radio show, The Conversation, Saturdays on WOKV from 5 to 6.